One of the tricks that I mentioned we use that has been effective in treatment of cancer, it's also very effective in treatment of various bleeding conditions, is what is called embolization. What that means is that we go inside the arteries, and from inside the arteries we block the arteries, so stop the flow to a certain area. Let's say you have a bleeder that you go in there. In the past they would have needed big surgeries to go tie off the blood vessels. Now it can be done from inside of the vessels, and you go in and you basically block the circulation. It can be used in cancer patients, it can be used in patients who have stomach bleeding, it can be used in patients who have trauma who are bleeding, and it's very common. The way it works is that the circulation, obviously, it's like a big highway. They're all connected. So you enter, put a small IV in one of the arteries, typically in the groin, and then navigate into the site of the bleeding or the tumor or the target that you want to stop the circulation to. And there are small catheters and tubes that allow you to do that. Once you get there, then there are a variety of instruments and devices available to stop that flow. One of them that is common for cancer are small beads. And these beads can be anywhere from the size of a grain of salt to as large as several millimeters. And these can be injected into the particular artery and block it. For tumors, we tend to use the smaller ones to penetrate deep into the tissues and cause tumor death. In bleeding conditions, we don't necessarily do that. We use other forms that may be more temporary, so when the injury heals, that artery can open up. Or occasionally we can deposit what we call things that are called coils, that are pieces of metal with some fiber on it that causes immediate clotting of the blood. So there are different techniques and instruments and devices we could use to do that. Interestingly, that has led into a lot of developments that have been shown to be highly effective in cancer. We've taken the same kinds of beads, the grains of salt, or slightly larger, and made them radioactive. So what you could do is you can actually radiate the patient or a tumor from inside without having to expose them to a large dose of radiation from outside or involve other organs but the tumor itself. The same principle as the chemoembolization. And we've also been able to load various chemotherapeutic agents on these beads. So you implant them inside a tumor, and over time they give off drug and expose the tumor to cancer for a longer duration of time, more than the few minutes that we are there with our catheters.